Well, I'm happy to follow through here with the rest of the presentation, but I'm going to do so with plenty of these devices. There's lots of them here, and I want to underscore what you've heard from all of us in the R01D series of presentations so far, which is that silence doesn't necessarily mean that there's nothing there that matters. I'm not angry, I just happen to be sobbing. You know, that kind of, the word devastation that I think Gwen just used. These are words that carry evidence that there is an enormous amount of meaning where sometimes that we at the moment have nothing but silence or no information. So this work is really just beginning. And I'm going to give you a little bit of a synopsis of the rest of the work that we've been able to do in this project so far before returning to an overall summary. And I'll try and keep it quick because we are a little short on time, but I don't want to do short shrift on anything either. I'm going to be speaking about the project that our own, from this current project, health economists have been doing, David Dranoff and Andy Spekas, were interested in trying to get a handle on how do you think about cost and health insurance and oncofertility. There is obviously going to be a cost associated with this procedure like any other medical procedure. It may be even harder to turn that, that price tag into something that we can quantify than other medical procedures, but nonetheless it's going to have to be done. So he chose a method called contingency valuation, and you've heard a little bit about this project in prior years, so this is an update. But for those of you who didn't hear that presentation or don't recall, contingent valuation is a method that's chosen as opposed to the QALYs, which is what Gwen just mentioned her colleague will be using. And contingent valuation is pretty much just a direct survey of what would you pay for this? You describe the service and you say, what would you pay for it? And you ask that question along with other items that they also have to decide what they would pay for that are more common, a car, another medical procedure, a plasma screen TV, that kind of thing. So they asked in a fairly detailed, well-designed survey what people would value, what they would pay for ovarian tissue cryopreservation. And the long and the short of this is that this project also was slow to get done because it was hard to find people who would take the survey and hard, I think, for people to complete the survey. Nonetheless, with a great deal of hard work, it was completed. And it turns out that oncofertility fertility preservation through ovarian tissue cryopreservation was perceived as cost-effective by patients at or above the estimated actual cost of $30,000, which is what the average facility was charging for the procedure at the time that the survey was initiated. And WTP stands for willingness to pay. So the willingness to pay was at or above $30,000, and this was again calibrated against other common goods or medical procedures. The willingness to pay for lifetime insurance for this procedure was much harder to calculate than to figure out, but they tried to understand that as well based on the expected cost and the probability of it happening, which is just the incidence of it being a relevant question for women in the population, which was calculated at 1%. So in this study, it was young women, parents with young adult children from the Chicago area. And young women's sample is 99, and parent sample still in progress is 60. And the surveys were completed as described. Preliminarily, they have been able to discern that most people believe it is important to have children or grandchildren, and that very few are morally opposed to any reproductive technologies whatsoever. Now, I think that, again, we have to take this finding with a grain of salt. People are not yet really exposed to the nuances of the issues, and it's really quite easy to say, of course, fertility preservation is a no-brainer if you've got somebody with cancer, but they probably haven't had a chance to think about all of the issues. So that is a finding, but as you've already heard, there are many issues in addition to that from our other data. So respondents also appear to value OC at its actual cost, more or less, and the valuation turns out to rise with the probability of success, which is intuitive, reasonable, but it has a kind of concavity to it, which seems to reflect perhaps how desire for fertility rises as the option for it disappears, and people seem to need greater hope, and perhaps rather similar to spending a lot of resources towards the end of life. The less you have of it, the more you're willing to spend for it. So there is a kind of increased valuation as the probability of success declines. Now, interestingly, when it comes to insurance, parents seem to value the insurance, but children or the young adults seem to either undervalue it or value it not at all. They wouldn't buy it, period. So again, we've got evidence, I think, that people are not really at grips with the issues that are in front of them. We've got children saying, or adolescents saying they're not angry, but they've clearly got deep, deep feelings of some kind. And we've got children wanting to spend $30,000 for it, or young adults $30,000, but nothing on insurance. So I think we've got evidence there that there's a good deal of road to travel before we know how people can come to grips with this issue. They also looked at moral hazard utilization, by which they mean the willingness to engage in a procedure that really isn't relevant to them just because it's been covered by insurance. So they're willing to have ovarian tissue cryopreservation, perhaps even though it's not really relevant for them, but they've got insurance, so they're going to do it anyway. And that data isn't out yet, but they have some on that very important question. We need to know that kind of thing in order to provide good, solid, informed consent to people. So I put up, I think, one of the things that we're realizing is that there are many different ways to reaching cognitive engagement with these difficult issues. And words are only one of them. And we tend to be quite cognitive in this academic world that we live in, but pictures are another way. So I put up 3 pictures here. Here's a mother and child, and the people in this survey are valuing the ability to have a child after cancer at the same level that they are valuing a new Toyota Corolla or a torn cruciate ligament repair, which I would put to you is not concordant with the way we actually value our ability to have children. So I think there is evidence that we can get enough rational commodification, dollar values on these services that we can calculate how to put fertility preservation options into our insurance benefits and to put a price tag on the services. But I think we also have evidence from this result that people are not really coming to grips with the issues. So that's what we've learned from our economist study so far, and the results will be forthcoming because the data is almost complete now, thanks really to the excellent, excellent work of some of our tireless support staff. Carolyn Goldstein is here, and Jamie Metcalf has just moved on and really did a great deal of work on this.